Good evening.
Good evening.
Can I welcome you all to the first virtual Health and Social Care Scrutiny Subcommittee meeting? Can
Sorry,
everyone
Rick,
hear
I
me?
can't hear you.
Can't hear
Your voice
you.
is very sort of like
I'm normal. I've unmuted myself. Can you hear me now?
earlier on we could hear you very clearly.
Yeah, because everything is okay.
Rick, I can hear you, but there's a bit of a background buzz to your microphone now.
Okay. Is it the fan? We can hear
Yeah,
the
that's
fan?
better now. Can hear you now.
Can you hear me now? What about others? Can you all hear me?
It would help if everyone else who's not speaking went on mute. So if everyone who's not speaking goes on mute, it'll probably help the sound from yourself, Councillor.
Okay. So can I speak now? You can hear me now?
Yes,
Okay.
you can.
Sorry, I'll welcome everyone. Can I welcome you all to the first virtual Health and Social Care Scrutiny Subcommittee meeting? Present are members and advisors of the subcommittee, council officers, partner and organizations, and portfolio holder of adults and public health. Can I refer members and officers to the published protocols for holding virtual meeting? Please note the following. Members of the subcommittee should ensure they have their videos on and at all times, but to put microphones on mute unless speaking. Other members and officers should switch off their videos, and in case of a technical problem, the meeting will adjourn until the issue is resolved. If the technical problem persists and the meeting is incorrect, the meeting will be abandoned and rearranged for a later date. The meeting is being audio and video recorded and will be available to watch, listen to on the website. Is everyone okay? Would the members raise their hand from their function bar to indicate if they want to speak? Item 1, notification of a replacement of a councillor on the subcommittee. Can the subcommittee note the replacement of Councillor Chris Moat by Councillor Dr. Leslie Lewinson as the main member of the Health and Social Care Scrutiny Subcommittee? Can the subcommittee note the Councillor Chris Moat will occupy the position of second reserve? On behalf of the subcommittee, I welcome Dr. Lewinson and thank Councillor Chris Moat for his contribution to the work of the subcommittee. Thank you. Attendance by reserve members. We don't have any reserve members. They're all in the committee. Declaration of interest. Have any members any declaration of interest to make? Item 2.
I have a declaration of interest, non-pecuniary interest, as my father.
Okay.
Can you hear me?
Yeah.
As my father is in a Harrow care home, and this matter will be discussed later.
Okay.
Thank you.
Councillor Veena Mishani?
Yes, if we're going to discuss COVID and if public health is mentioned, I work for public health and it's non-pecuniary interest.
Okay, thank you. Okay, can we approve the minutes of the meeting held on 3rd of March 2020?
Yes, they are true and correct.
Okay. I don't know, Dr. Lewinson is the councillor.
I have one thing to say. Reading through the minutes of the 3rd of March, I noticed that the people in attendance, there are 2 names missing, John Hinckley and Jean Lammerman. Their names are missing.
That's not important now. We can deal with it later on.
Okay, that's fine. I just wanted to mention that.
Yeah, so that's fine. So appointment of vice chair. Please, can I have nomination for the position of vice chair?
I think Leslyn was gonna nominate me when we spoke earlier on.
Yeah, I've got my hands up, Councillor Shah.
Okay,
on mute.
sorry, Natasha, Councillor Proctor, couldn't see it, sorry.
Hi, it's okay.
Yeah.
I would like to nominate Councillor
Okay.
Matani as Vice Chair.
Okay, is there a seconder?
I will second it.
Okay,
Thank you.
okay. So,
Thank you.
Are you appointment
Both
with
of
the? Are you happy with the appointment, Veena?
Thank you, Natasha and Leslyn.
So you are vice chair. Thank you. Let's move on. Appointment of non-voting advisors and subcommittee. Can subcommittee agree the recommendation?
Yes.
Yes, thank you. Public questions, item 7. There are no public questions. Item 8, petitions. Are there any petitions? There are no petitions. 9, reference from council. There are no references. Now we move to item 10, COVID-19 recovery plan for the Harrow Health and Care Partnership. Sorry, Councillor Lewinson, yes.
Could I just say something before we start on that?
Okay.
And Chair, I would just like to raise a general concern relating to the Harrow Recovery Plan document. I'm a new member on this committee, but I have been in the area of nursing and healthcare for over 40 years and published papers and documents. However, I had some difficulty making full sense of the Harrow Recovery Plan due to the number of abbreviations that did not have an explanation or abbreviations that were not written out in full. Out of 67 different abbreviations, only 10 in this document were explained. This could put anyone unfamiliar with these abbreviations or terms at a disadvantage. And some abbreviations that you think you recognize could mean something entirely different. Overall, this is distracting when reading through the document. Accordingly, may I offer a polite suggestion going forwards that a glossary is added to this document and any further ones submitted if full explanations are not written in text. Thank you.
Okay, thank you. We'll start the meeting and then we'll deal with it. We can't do anything now because we are having virtual meeting. Okay, so you should have raised with me 2 days before the meeting. I could have done something. I can't do anything now. Okay, so let's just continue with our meeting. Would Paul Hewitt, Corporate Director of People, introduce the report? Brief in 5 minutes, please.
So good afternoon, councillors. I think the challenge that was brought by Councillor Lewinson is probably a fair one, and we will take that away and have a look at it. So I just want to acknowledge that it was written for a certain audience, and we will need to rethink about that for the future. Notwithstanding, I think this is a very fine recovery plan. We're very fortunate this evening to have with us some of the system leaders who have responded to the COVID emergency, and the partnership working has been extremely positive and strong, even in the midst of tragedy and pain within the community. So I think it's an opportunity to take some reflection on what we've learned during this period, but also to look to the future about how we are going to move forward together to recover in terms of our partnership in health and care. I think Javina Segal, who chairs the Health and Care Executive with me, will introduce some of the key headlines from the plan, which I know that you will have read. So I'm going to hand over to Javina now, and then we'll follow up later.
Thank you, Paul.
Thank you, Chair, and thank you, Paul.
Good evening, Jeremy.
Good evening, Chair. Good evening, everybody. And thank you for this opportunity for inviting all of us, me and all of our other system partners, to partake in this discussion. It gives me great pleasure on behalf of the Harrow Partnership to present the Out of Hospital Recovery Plan and to hear your thoughts in terms of the information and the work that we have put forward. The response has been developed and is being delivered through the Integrated Care Partnership Governance and Delivery Framework. This is overseen by the Joint Management Board and the newly formed Harrow Health and Care Executive that Paul referred to. This has become the epicenter of the integrated care work locally, with all partners supporting each other in responding to COVID-19. The Health and Care Executive has brought together on a weekly basis senior representatives of the acute sector, community, mental health, social services, primary care networks, voluntary and community sector colleagues, CCG, and broader council services in one single discussion on a weekly basis. This has really built the foundations of a system that will enable us to drive improvements in health and well-being, help us address and understand our reduction in inequalities, use of collective resources in a way that is sustainable, so that we can meet both the current demands across these areas and our future health and well-being priorities for Harrow as a whole. I think there are some key things of the plan that I must point out to you, because it's been quite a unique process in putting this together. I think the plan has been developed collaboratively with partners across the system. It has built very much on all of the integrated care work we have done previously in Harrow. We have always been keen to have one set of business as usual priorities, and actually one of the good things to come out of this difficult experience that we have all been through is that this has allowed the plan to help us do so. The plan has primary care at the front and centre, the delivery of all of the delivery plans really as a bedrock, and we are really pushing our primary care networks as a unit of delivery moving forward into the future. There are some key elements of the plan which include a very clear understanding of the shared principles of how we work as a partnership, how we will manage population health and tackle inequalities, very much about learning all of the things that we did in terms of our COVID responses, which was good and we want to build on, and areas that we can strengthen in case of additional surges when we have them. Really look and understand the care models we have for both planned care and urgent care. Plan for recovery and future surges, but also really do all of this with immediate priorities for the next 100 days. I think in terms of a couple of key points in terms of the approach, we have followed the approach that has been taken by the North West London Integrated Care Partnership Executive. What they have got is a named system leader leading on a particular area, and so the whole system has shared ownership and a collective responsibility. Work has already started in many of the priority areas that you have seen in the plan. We have already started the process of implementation, with each primary care network taking ownership and leading on an area alongside with another system leader. And really, we have two principles at the heart of delivery that is really empowered.
You've gone on to mute.
Sorry, is that
Thank
better?
you.
That must have been by accident. I do apologise. We have 6 areas in the plan. These are namely long-term conditions, children, young people, frailty, a focus on care homes, looking at prevention and inequalities, and all of these are underpinned by education and training. whilst we will have a lot of discussion during the course of the committee, I think it's really important to leave you with some next steps in terms of translating the recovery plan into an implementation plan, referring back to the 100-day priority. So the first and the most important part of this is really communicating and sharing the plan with our stakeholders, not just our local residents and communities, each and every voluntary sector organisation, and we have over 800 of them. We're quite blessed in Harrow. We are in the CCG planning to record a video in terms of our recovery-related actions. We hope to do that very shortly, explaining what the new normal is and also linking all of the information that is in this recovery plan. We have a letter that is going out to all of our registered patients and indeed residents of Harrow, explaining the work that we have done during this period and how they can get engaged in this process and in this journey. We're trying to align all our existing organisational plans and have shared objectives. We want to embed the governance, the leadership and the financial arrangements to support this implementation. We're looking at organisational development and training plans, how we can do things differently, how we can use different skills shifts to support the delivery. And lastly, looking at teams to support the implementation priorities. So I think what I have done in a very succinct way is give you, what is being done in terms of all of the information that we have put together. And it would be really helpful to hear some of your views, answer some of your questions, which will help enrich the plan and the delivery even further. So thank you. And just before I hand back to Chair, Chair, with your permission, can I take this opportunity on behalf of both Paul and myself to thank our other system partners, all of who are on this call, for their commitment and their energy that they have put in. Any plan is only as good as the input that goes into it. And our plan is a very well talked about, loaded plan, not only in North West London, but also in London as an exemplar of partnership working. That has only been possible with everybody's input. And the fact that we have each and every partner at this committee is testament to that. So on behalf of Paul and I would just like to say thank you.
Thank you. Thank you, Javina. As Genevieve Small, Chair of the CCG, any addition to make to Paul's and Javina's induction? I mean, does anything to say?
Thank you very much, Councillor. I really couldn't increase what Javina and Paul have already outlined. I would just like to say that as co-chair of the Joint Management Board that will oversee the delivery of this plan together with Sean Harris, it has been truly a pleasure to see how through this extraordinary set of tragic events we have managed to come together in a way that we have aspired to over quite a long period before, but we're actually seeing in action the activities that will actually aim to keep our residents have better care for the future. And I think that's the best legacy we can try to have out of these tragic times.
Thank you. Are there any questions or comments on the report? Veena Mithani, Councillor Veena Mithani.
Thank you, Chair. I must say I agree with Javina. It's a very thorough report. A lot of work has gone in, and it is sort of well laid out plan and easy to understand with various pathways. My question was, the decision around a single CCG for Northwest London is imminent, and will the senior management capacity for the region shrink from 8 managing directors to 3, with changes planned from September to go live in March 2021? how will that affect us? And will that have any impact on patient management or care homes or GP patients? I don't know who will answer that, my question, but I leave it open for Javina or the CCG chair to answer.
I'm just wondering whether I should start that, if I may, Chair.
Yes, please.
Thank you. So at the governing body of the CCG yesterday, we did approve a continued work towards the development of a plan towards a single CCG for North West London. Obviously, no absolute decision has been taken on that as yet. It will come back to the governing body in September, having gone out to our member practices in the interim time, as we are a membership organisation. This is an aspiration that was set out by the government through the long-term plan, that they wish to see the CCGs follow the same footprint as the integrated care system. So the integrated care system exists across North West London, and actually during this period of COVID emergency, we have seen in action a fantastic working together of all of the different component parts of the integrated care system, which has paid benefits for patients in ITU because they've been able to access beds across the system, patients who have mental health crises, patients who have been in care homes, and we've seen a really coordinated response in terms of what the integrated care system looks like across North West London. This plan that's come before you today is more focused on the Harrow part of that delivery, of course, and that's the bit that we're, of course, the most interested in at the end of the day, but don't let me tell anybody in North West London that, of course. But at the end of the day, the CCG sits as an example of how to facilitate change. Commissioning and provider, the commissioner-provider split is definitely getting blurred in this closer working together. So we have to think about how we best deliver care and what is the role of the CCG moving forward. What is absolutely clear is we need a local voice for Harrow. We need to have the responsiveness that we need for Harrow, and we certainly wouldn't get an endorsement of our member practices if they actually felt that that was going to be diminished. But I think, Councillor Mathani, one of the things that you're talking about here is more how does the system operate and what is the operating model for the management provision. We are incredibly fortunate to have a fantastic management team in Harrow, which of course is led expertly by Javina. But as well as that, we are supported across North West London. And so what we're talking about now is how do we get the best value for money, taxpayers' money? How do we get best value for money out of that management system? And it might mean, and none of this is confirmed yet, but it might mean as we look at that system, we need to slightly bring together different parts of that system, potentially into different groupings. So your suggestion around 3 potential future groupings, that is not yet decided. There will be, of course, a staff consultation. We will listen to what comes back in terms of the staff consultation and take the views of others around the system, including yourselves. But at the end of the day, we need to make sure that we have a system and a structure of management that is fit for purpose for the role ahead of the CCG, potentially as North West London, and then delivering that in partnership with our providers and with yourselves at a Harrow level. So I think it's probably a little bit too early to be able to tell you exactly how that's going to work in practice, but we're always welcome to come back, I hope, with you invite us to talk about that on another occasion.
Thank you. Can I just add on another question?
Sure, sure.
Yeah, it's about the ICP. How is it different from what existed before? And what difference, if any, will it make to the patient's journey through Harrow's healthcare systems? Javina or yourself?
So I actually wonder whether it would be Javina and James that would perhaps.
I thought so, because it's ICP related. Yeah, Javina is on mute and we can't see her. Can Javina hear us?
Javina has to unmute herself.
Yeah, and can we? Probably she can't hear us. So
I can't unmute. She has Javina.
Take that question for us.
Hello,
So
Javina,
maybe
can
we
you hear me?
should send a message through the thing so she can.
I
So
think,
can I ask that James starts?
yeah, let's start with James.
So we're talking about this James.
Oh, hi.
Yes.
Right, we need Javina, not James, but is James going to give you
If James
answer?
can answer, that's great.
So hello, councillors.
Hi, James.
Hi, it's
to
James
our
Benson, the Chief Operating Officer for CLCH. I think where we really need to get to is bringing all of our out-of-hospital services together, working in collaboration with our primary care colleagues to create a proper community of health and social care delivery for the residents of Harrow. And I would echo Javina's comments. I sit on a number of these meetings on a weekly basis, and it is really only the Harrow system where I'm seeing a level of coordination, support, engagement from all partners, be they health, social care or the voluntary sector. We've discussed at length the need to bring all of my community nurses, our therapists, together to actually support all of our really vulnerable patients in Harrow, and how we do that. So we create one single leadership function for the residents of Harrow and really work collectively with our GPs to promote best care, limit the number of patients who are inappropriately accessing services, and really start to think about what we're doing to improve healthcare for all of our residents.
Thank you.
Okay.
Sorry, Chair, I had an internet issue. I'm really sorry.
Okay. Sorry.
Would you like to add anything more? Were you able to hear the response?
Sorry, I didn't. I'm very
Okay,
happy
you
to
didn't hear.
answer the question. Would you mind just repeating
Yeah, I'll
it for me,
repeat
please?
it. What my question was, how is the ICP different to what existed before? And what difference, if any, will it make to the patient's journey through Harrow's healthcare systems?
So I think James has already picked that up. I think the ICP is very much, we are one Northwest London. Harrow is very much part of that Northwest London. The ICP is an integral part of the ICS. I think what we're trying to do is not try and have siloed work happening. We want the integrated work to really be part of our business as usual, to see what learning we've got from, this COVID-related experience. It's helped us do things in very many different ways. Some things we've been aspiring to do for a long, long time. And so it's helped break up those boundaries and, work in a much more connected way. So I think actually the ICP work that we are doing here now has gone much further forward in the little time that, in the last few months than it has in several years. And actually, it's just an aggregated, the ICS that we see at Northwest London is just an aggregation of all of the local partnerships working together. So I would envisage the Harrow patient's journey to be much stronger through this experience. And obviously, we're still, is it fair to call it sort of in early stages? Yes and no, because actually we have been doing this work for a very, very long time. We're just going to do it differently at a much faster pace. We're hoping to take everybody with us. So I don't think it's going to be hugely different, apart, from what we've been doing, in this most recent period. So I hope that the patients will notice a difference. And it was all of the things that James has said. We have to think of doing things differently because, we have different limitations on how we provide services. And I think all the more reason for us to come together, because the level of capacity we had earlier and how we operate now is going to be very different. So I think it forces us even more to come together as a partnership. So I think, yes, it's definitely onwards and upwards.
Thank you.
Thank you, Javina. Can I have Councillor Natasha Proctor, please?
Thank you, Chair. I think that's quite a few questions on your ICP. I was going to ask something else, but before I move back to that, I just wanted to kind of look at the situation we're in right now. So we've got the recovery report, but I was just wondering if you could give us some more information on what's happening right now. So I know that shielding is coming to an end soon, and I understand Harrow has around 12,000 people that were told to shield. Are there any key public health messages that we as councillors should be reinforcing with the community and our residents at the moment? And if you could please also, with reference to the Public Health England reports on the adverse impact of COVID-19 on the BAME communities, could you again give me some picture of what's happening in Harrow, and if there are any reasonings behind the disproportionate effect that we have seen? I'm talking specifically Harrow here rather than the country as a whole, so I'm not sure who the best person is to go to with that question.
Hi, Chair. Would you like me to take that question?
Yes, please. Yes, please.
Hi. On shielding, yes. I mean, I think through the whole of this coronavirus crisis, we've had lots of change to have to react to, and I think this is just the latest change. I think one of the important things is that we continue to make sure that we're not going to have a resurgence, and I think the track and trace, which no doubt we'll come on to talk about later, is going to be vital for that, and I think the system seems to be working very well. The number of cases that we've had in Harrow in the last 2 weeks has been maximum of 3, I think, in one day. Most days it's only 1 or none. So that's been really good.
Sounds good, yeah.
Yes, it's so much better to the situation we were in April. I think with regard to the report on the disparities, there's a number of reasons I think why Harrow finds itself at the sharp end. We have an older population than a lot of London, so we can expect to see a lot more because it's affecting the older people a lot more. We have more residential care than in a lot of places, so a lot of inner London where you might expect to have more cases because of some deprivation issues. They have very few care homes, so care homes have been a really big focus for us, and we can go into some details about the work that we've been doing to try and protect people in the care homes. I think the other issue is around the BAME communities, and there's an undoubted impact that we've had on those communities. What we're not able to say in Harrow, because we don't have that data at the moment, is how much of the impact has been due to how much of the impact of COVID has been due to BAME communities. But as that's a significant proportion of our local borough, it's likely to be a large proportion of people. What I can say is that the inequalities that we've seen in COVID are not inequalities that are unfamiliar to us. What we're seeing is it's highlighting inequalities rather than causing the inequality in itself. So we've known for years that people from BAME communities suffer from more long-term conditions. We know that, for instance, Black young men do worse in school, have worse outcomes. We have lots of differences in terms of education, in terms of housing, in terms of overcrowding, in terms of jobs and the level of the people's jobs. And I think what we're seeing is the result of all of those inequalities coming to the fore. One of the things that Javina mentioned was that we're going to be doing more work on reducing health inequalities, and that's going to be a significant part of this recovery plan, that we can actually start looking at all of those inequalities when we find them, actually try and understand them and try and turn them round. So I think that's pretty much all I can say at the moment. When we do start getting more data, which we're assured that we will get more local data, we'll be able to provide you with some reports on that as soon as we can, really.
Thank you, Carol. That's really useful. Just really quickly before I move on to that, can I just ask, in light of all of those kind of specific local issues that we see in Harrow as averse to other parts of London, what are kind of the key public health messages you think we should be sharing with our residents when we speak to them? Is it just following the guidance as it's been given, or is there anything specifically to Harrow that we could be trying to advise people?
Yeah, I think that following the guidelines is, I don't know how many times I've told people to wash their hands in the last few months, a considerable number, and shown people how to wash their hands and shown people about wearing PPE, and I've had so many conversations like that. So I think that, it's really important that people get those messages, and that if they are wearing a face covering in public, that gives the other people that they're coming into contact with protection. It's not about protecting you, it's about us all taking that responsibility to protect everybody else in society. So I think that's an important message to get across, and and continuing with some of the issues that I've seen when I've been out and about in the borough, about people wearing gloves, and then you see them, they wear gloves thinking that they're protecting themselves, and then they touch their mobile phone and they touch their face, and and all they're doing is just spreading any contamination around. So we need to get those sort of messages across, and I don't think that's peculiar to Harrow. And then we need to start thinking about, well, what is it that we can do to protect ourselves, about how we can, live healthier and reduce the amount of long-term conditions and diabetes and heart disease. We're just trying to look at that. We're going to be launching the health and wellbeing strategy at the Health and Wellbeing Board next month, and alongside that will be a plan on obesity, and we'll be looking at more at mental health. So there's lots of messages, and our comms team have been really supportive in trying to get those messages out to people.
Okay, thank you. Yes, Veena.
Thank you. Just a question for Carol. How is that tracking and testing coming along in Harrow? And have you got any data about how many people have been tested, or if you've received any results? Are they positive, and have they managed to track more people?
Yeah, as I said, we've had very few cases. And all of the cases have been managed largely by tier 2, which is the contact tracing, the centralised contact tracers. We've had escalations to tier 1 for people in settings like care homes. We've had a couple of cases in care homes, but we haven't had anything that's approaching a community outbreak. We did have one case where wasn't a Harrow case, it was a case from another borough, but the contact was known to Harrow, but was also homeless, so he was quite difficult to track down. But we've managed to track him down, and he's been tested, and he's also being found accommodation. So it was a good news story in the end, even though it was quite painful to actually try and track this down. But I think it was a very good learning experience for us.
Thank you. Can I add on another question, Rekha?
Okay, thank you.
Okay, mine is about business continuity plans and how are they in place for pandemic COVID for each individual trust and across partnership operations. So if anyone from the trust can answer that question, please. So about business continuity in trusts and partner organizations, and how is it managed? And
okay, I'm happy to respond to that. Can I, after I've done that, can I come back to, because I did have my hand up earlier to respond to.
Sorry, Simon, I didn't see your hand. It just came as unknown. So
yeah.
if you put your name, it would help, please.
Oh, right, okay.
It say unknown person would like to come in, so I couldn't invite you.
Okay,
welcome to our meeting. Sorry.
Use the hand signal on this, but okay. Yeah. So in terms of business continuity, then so obviously our initial response to COVID was an emergency response to COVID. We stopped our elective surgery procedures. We opened more critical care beds and increased our capacity. And as time has gone by, then things have stabilised in terms of the number of COVID presentations that we're seeing within the hospital. We're seeing around about 1 every 3 days at the moment in terms of positive admissions from the peak when we was seeing 100 plus a day. So in terms of our business continuity plans going forward, then clearly what we're trying to do is bring as much elective activity back on stream across our acute sites as we can. We've entered into a number of contracts with the independent sector for elective activity, as well as arrangements for cancer care with the Royal Marsden, and more recently with the London Clinic for some of our more complex surgical procedures. And we've also then been trying, as there's less dominance of COVID positive in the hospital, trying to create clean pathways in our hospital, or COVID protected pathways in our sites, so that we can bring patients in through a protected pathway to limit their potential to be infected by COVID positive patients. So that includes at the front entrance, hand gels, wash, face masks, etc., but also different routes into those procedures for endoscopy, for X-rays, etc. So we've started elective activity back on the Central Middlesex site. We did a walk round on the Ealing site yesterday, which is peer reviewed. It's not just the trust making that decision; it's peer reviewed with other trusts across Northwest London. So that's been assessed as being compliant with the COVID protected pathway. So we're looking to bring elective back on in the next 2 or 3 weeks, subject to formal approval by the ICS, and then we're looking to do the same for Northwick Park as part of a similar walk round that'll take place next week, and then towards the middle of July, looking to bring activity back on the Northwick Park site. And then recognising there's a potential wave 2 and further surges coming down the line, we've done what worked well in terms of response to COVID. What would we want to keep? What would we want to replicate or do better next time? So we've got a draft sort of how we would respond to wave 2 in terms of continuity plan, and a key part of that is trying to make sure that we would be able to continue to protect some of those pathways and maintain some of the diagnostic and elective activity going forward. So a massive amount of work has gone into doing all of that. So So that's it at a high level, really, and I'll pause at that point if there's any questions on that. Otherwise, I'll come back to answer a couple of the other questions.
Thank you, Simon. Rina, are you okay?
Just one more question on.
Oh, can we finish that one and I answer the other ones before we?
No. It is related to what you just said on business continuity.
Oh, if it's about business continuity.
Yeah. So now you're gonna be introducing the business as usual. And have you got enough staff capacity? And if you have a second wave, have you got enough nursing and medical staff and healthcare assistants to support both the work? Or will you then, if God forbid, but if second wave did come, will you stop all the work again, or what is the plan?
So the simple answer, we have not got enough staff to get anywhere near what we were doing pre-COVID and what we need to do to recover and keep in place the additional critical care capacity that we have put in place for a potential surge. We're not alone in that. All of London will be in that position, because we are now maintaining 48 critical care beds on the Northwick Park site, where traditionally we had 21. Critical care beds, by their very nature, are more labour intensive in terms of staffing to staff and maintain. So therefore, we've taken staff away from other areas to support that. So we can't put all that capacity back in place, and we've got to keep two separate pathways in place on all three sites. Well, not so much on the Central Middlesex, but on the Northwick Park and Ealing site, we've got a COVID protective pathway, and we've got a potentially COVID positive pathway. So that brings in efficiencies in itself. The fact that we've got to don and doff and the staff change and protect themselves, we're not as efficient in terms of the volumes of activity that we're going to be putting through our theatres, because we've got to clean it after each one and that kind of thing. But staffing is a big challenge. So we are looking at so part of the contingency plans of those staff we have redeployed this time. Being clear who those staff are, what other staff can we redeploy going forward, what additional. So planning for wave 2, we got chance to plan and maybe do additional training that we didn't have in response to the initial wave. So that's the sort that we are doing to try and make sure that we can respond to that appropriately. And we absolutely do know better what worked last time round in terms of when patients came in through the emergency pathway, whether we put them in single rooms, where we assessed them, which wards we used for what purpose, and which ones we freed up in terms of pathway. So we will be more efficient and effective in doing it next time round. But there is no doubt that one of the things we will be doing is careful monitoring in terms of, we will be looking at predictions around attendances through A&Es, around breathlessness and breathing difficulties as potential triggers. Also, the system is doing that by the number of calls into LAS and perhaps GPs as well as part of that. So we will hopefully be better informed to respond quicker than we did last time around. But there's no guarantee that we'll be able to maintain whatever elective we do put in place at the same time responding, depending on what the scale of it's going to be.
Lovely, thank you.
Thanks very much, Simon. Can I get Julian?
Can I just answer the other two questions I had there? So one was I think it was Natasha's question around the prevalence and the impact on the BME community. The data we've got in terms of our deaths, there is no discernible difference in terms of the different communities in terms of our deaths. The biggest factor in terms of the number of deaths is the age profile of the patient and the comorbidities. So in terms of the age profile, 85% of the deaths are over 60 and 68% 3 or more comorbidities. So but you made absolutely the right point earlier, is there's a bigger prevalence of some of those comorbidities in people from the BMA community. So it's not the response once they get into hospital that maybe or maybe not appropriate. It's the fact that they are more likely to present with those complex level of comorbidities that gives them a less chance of survival. And then the other thing I was going to say, when you talked about the ICP earlier on, what I would say is since January, it's been a much more regular soundbeat in terms of meetings and senior level attendance in terms of those meetings for the ICP. It's been well facilitated and supported. And I think what the benefit of that was seen in terms of when we mobilised in terms of responding to COVID, there were already good working relationships in place between the key stakeholders from the organisation, including the voluntary sector, I would say. And so 2 examples of us being able to respond effectively then were, one was around the implementation of a hub to support discharges, and CLCH took on responsibility for leading that from Northwick Park, but also supporting Brent and Harrow, and that was enormously beneficial and effective for us in terms of supporting discharges. And the other thing I think that's been quite beneficial is things like this. The MS Teams has enabled, if you like, the likes of myself and Martin Cooper and Lisa Knight, our chief nurse. We've had quite big meetings with Genevieve and the PCN leads, and in terms of describing to them some of the issues we were having and what we were doing to change practice and how we were planning to bring elective referrals back on play. So it's helped facilitate different ways of working as well. So I've said a lot. I'll pause at that point. Other people may want to comment.
Thank you, Simon. Can I have Julian Wall, please? Julian?
Yes. It was really a response to one of Mahini's questions earlier about the patient seeing the changes coming out. And I think the big thing at the moment is e-consulting. And all patients trying to contact their GPs are going through e-consulting. Now, that is a big change, and it's what will affect the patient. There's also virtual first, by which the trusts are ringing patients instead of them having to go to outpatients. Now, this is all part of the change that I think we hope is going to become the norm, but it wasn't before. That was all. I think this is one of the big changes that patients are seeing.
Chair, can I just come in on that, just because it's to do with the way that patients are accessing primary care in particular, and I just want to clarify a couple of Julian's comments.
Yeah, sure.
Okay, thank you. So I think Julian is talking about 2 slightly different things in terms of primary care. So to do is part of the COVID response was we had to make a virtual by default way of contacting your GP. So anybody who's contacted their GP over this period will know that the first instance is to do so on the telephone, or perhaps by video, or perhaps by using this e-consult mechanism that Julian is talking about. The need for that is really to try and keep patients and staff safe. But as a spin-off of that, to be honest, I think that people have actually quite liked the increased responsiveness that they have had from their GPs in terms of being able to get answers a bit more swiftly than perhaps was always the case before COVID. So it's an example of how some of the things that we've done as a response to COVID will become much more things that we take forward into the new reality, whatever that will be. The e-consult part that Julian is talking about is one specific way that you can use contacting your GP. That's not the only programme in Harrow, there's another one as well, but all patients should be able to go onto their practice website and make contact 24 hours a day to their GP via the online form, but then it will be looked at probably within the next 48 hours. It's not for urgent things at all, but it is for things that can be dealt with in a more kind of like cold way, quite convenient for patients. Some practices have taken the decision to try and encourage patients to use that for all of their contacts. But that is not the general plan across Harrow at the moment. At the end of the day, we need to be responsive to the needs of our patients, our patient groups, and ensure that at the end of the day, we provide service as they need it, at the same time keeping our staff and patients safe. I want to clarify that because it might be the wrong impression if we were saying that what Julian was talking about there was a global thing across Harrow.
Thank you, Genevieve. Are you okay, Julian?
Yes. The only thing really is I was referring to e-consulting, not e-consult or click. I know there's two systems, which I think is most unfortunate, but that's the choice of the GPs.
Apologies.
So that's all, but I still think that at the present time, that's the change that patients are seeing and feeling, because the first contact with the health service is invariably through the GP. Thank you.
Thank you. Councillor Natasha Proctor.
Thank you, Chair. This might be one for Simon again, going back to kind of staffing and long-term continuity plans. Obviously, this whole situation has had a terrible impact on mental health and morale for many people. I was just wondering what systems have been put in place for the mental health well-being of the staff that we still have. Understanding that we're, staff numbers are obviously lower than they were anyway. And feeding into that, in Harrow, I don't know if we've had any shortages or what the numbers were, but in terms of moving forwards, the procurement of PPE for staff, so again, them knowing that they're safe and secure doing their jobs. So somewhat related to the mental health well-being of staff, but I was just wondering if you could elaborate a little bit on kind of what's in place for that. Thank you.
So in terms of from an acute perspective, we had good support from our mental health colleagues. So I think it was West London that gave us psychological support in the early days in terms of some support to the trust. We already did have a sort of health and well-being scheme in place within the trust where people could access an independent helpline in terms of if they were experiencing sort of anxiety and concern. And clearly our HR department has responded in terms of access to occupational health and speeding up the response and support to that, and being really clear with our communication out to staff in terms of supporting them and advising when they need to isolate and those kind of things. So that was the response, if you like, in the first 4 or 5 weeks. Since then we're in the process of procuring. Well, we've agreed funding for I think it's 3 or 4 additional posts in terms of providing mental health and well-being support to our staff going forward. So we're recognising that we need to strengthen that aspect of our top department. And then in terms of PPE, we're absolute. So we weren't helped, like many other trusts, weren't helped by the changing rules and guidance in the beginning around what equipment was needed for what procedures and in what set of circumstances, as well as some of the supply issues. But what I would say is since mid-April, whilst there have been times where it's a bit hand to mouth, in the sense where we've got 2 days supply, 12 hours worth of supply, it's always come on stream, not always in the quantity and the volumes that we want and the choice, but it has come on stream. And I think we are in a better position than we were in terms of supply of PPE equipment. The challenge, I think, going forward is as we put on more of the elective surgery procedures, that will require more PPE equipment for that. And then if we have a surge in winter, then we need to see how the system's able to respond. But what I would say is the system worked well in terms of collaboration, and across ICS North West London there was a sharing, there was mutual aid. You know, we helped CWL out, Hillingdon would help us out, that kind of thing. So I think a couple of the other trusts want to come in.
Thank you.
Yeah, could I just comment as well? It's Tanya Paxton here from CNWL.
Thank you.
Okay.
Welcome. Yeah.
Thank you. I mean, just to say from our point of view, I mean, for the wider Harrow Borough, actually, our IAP services have really redesigned themselves to make sure they're far more available for anybody that's struggling with COVID, and we've been advertising throughout the ICS to make sure that all our service providers have been given that information. So that's very much out there, and our IAP services are supporting that. And obviously we help out in any other way that we can. As far as our PPE is concerned, similarly to Simon, for our mental health services, because obviously we still have patients in mental health services that are COVID positive as well. Similar to Simon, we struggled for a while there to get all our PPE, but now it really is coming on stream, and we're in a much better place with that.
That's great to hear. Thank you, Tanya.
Part of this team, thank you. Thank you. Can I invite James Benson, please?
So from a community point of view, I would echo everything my colleagues have said. From a PPE point of view, we have a very clear understanding of what our future needs are and have stock to supply that, and we have all shared quite in a really supportive way across all parts of the organisations and within NHS and social care. I think the other thing that we probably would want to reflect as providers of healthcare services, we are all working with all of our staff to do individual risk assessments and understand the risks in terms of impact if any of our staff had COVID, reflective of those individuals in our organisation who may be at greater risk of becoming unwell. And I think that in and of itself is quite supportive, not only for our staff here and now, but thinking about what that risk might be in a second wave.
Thank you. Can I invite Javina, please?
Thank you, Chair. I just wanted to add to what my colleagues have said and just make everybody aware we've had the Good Thinking service, which is the digital mental wellbeing service. It's an offer that comes from the Mayor's office. It's a pan-London service. It's really an online resource, picking up lots of issues around anxiety, bereavement, loss, sleep. And during this COVID period, they have come up with lots of materials. And actually, it's quite convenient for people because they can view it in terms of, you know, when they feel it's an appropriate time, they can go in and out of that resource. There's lots of CBT available online. You know, there's self-assessments and there's a whole huge resource pack. And that is also supported further by materials from Thrive London, you know, which we're very aware of in Harrow. So I think there's been a number of various organisations have put forward something, and actually there's been quite a big and rich offer of support available. And I think every organisation has tried to support, you know, the staff as best as possible, because we all acknowledge that this is a very difficult time for us. And actually, particularly all of the health staff have had to come in and support and do all of the, you know, key workers have had to come in and support people, whilst also facing lots of personal losses, both for themselves in their own immediate environments and at the workplace. So I think it's been a well-resourced offer, and I think we're very well placed if we were to have any future surges. I think this is one of the things that, you know, we've got a very good and strong offer of support.
Thank you, Shabina. That's really useful, all of those answers. Thank you.
You happy now? Any more questions?
No, all done. Thank you.
Thank you, Natasha. Okay, can I invite Councillor Lewinson, please?
We're all aware that a number of staff came out of retirement to man the health service and the care sectors. And I'm just wondering, in what way may the impact of COVID-19 affect recruitment of healthcare staff in the future?
Chair, I'm happy to come in from a provider point of view.
Okay, thank you.
So I think we have all been really blessed by the number of ex-colleagues who have returned or increased the amount of work that they are doing for the provision of NHS services. We've largely seen nurses, therapists and some doctors come back into service. And I think it's been really powerful for us all to recognise that having some members of staff who are working 1 or 2 days actually might be a little bit more progressive than we thought it could be. So we have been very flexible, and I think more flexible than we would want to be, and I'm really proud of us all for doing that. It probably does question our appetite to allow more flexible working for all staff coming and retaining in the NHS. The other big change that we've noticed as an organisation is we're probably more able to support some colleagues, largely women, in our trust, who wish to work flexibly, who wish to work around their own personal family needs and provide additional types of healthcare support. So as a community provider, we've been running an awful lot of digital clinics, digital support, and we can do those on weekends. We can do those at different hours that fit around the needs of families and really encourage probably a really different way of working moving forward.
Okay. Are you okay, Leslie?
I was just wondering whether there was anything additional in with regards to the recruitment of healthcare staff, because obviously these retired people, they're going to be coming out of the system, perhaps, I don't know, fairly soon or in the future, near future.
Can I bring in Javina? Javina would like to come in. Can I have Javina Saigur, please? Javina, can I invite you back?
Thank you, Chair. I was just putting my hand down. I didn't need to say anything, but actually I would echo everything that James has said. And I think we feel very proud. We've had all of the staff in the CCG who have really gone above and beyond the call of duty. And we've just been fortunate that we haven't had people who have been away during this time. And, you know, we've had most of our workforce either supporting the CCG directly, or actually we've had people who have been supporting the trust in terms of their COVID responses. So I think actually just building on what James has said, whilst we haven't run any recruitment during this period, because, you know, we've been able to use our existing staff that we have between the various organisations, I think we have come up with much more flexible ways of working, supporting and trying to support people with additional sort of family needs, carer needs and other responsibilities. You know, this remote working has really enabled people to work in a very different way. And actually, in a strange way, it's helped build the trust. So, you know, earlier people weren't comfortable with using some approaches, but now they've got to use different ways of working. And I think if we were to go out and do future recruitment, it will, you know, generate a lot more interest because people know that they will be supported to work in a different way.
Okay, Dr. Genevieve would like to come back.
So I was just going to perhaps pick up the theme of Councillor Lewinson's question, because I do think you're asking actually the right question there about the future. I think that we are all, if I'm honest, aware that we have put frontline healthcare workers in a position that perhaps they haven't ever had to think about before, in that they are literally risking their health by coming to work. And I think we are, as many people have said, incredibly proud of the fact that actually at this time of greatest need, people have absolutely stepped up to the mark. And, you know, this will be in the minds of the next generation of people who come into health and social care going forward, because we have seen their eyes opened about what is potentially possible. Anecdotally, I understand that applications into the professions is actually at an all-time high, but I can't give you the evidence of that. And I think that actually that speaks volumes for the generous nature of the people in this country. I've often said that in Harrow, we are probably a high producing area of healthcare workers. for a number of different reasons. And so I'm very hopeful that going forward, we will see our medical students, our nursing students, our care home colleagues actually fill those places coming forward that will be provided, because we have been very fortunate about our retired colleagues perhaps delaying their retirement or coming back soon after, and we have relied on them, and it has been wonderful to have their experience and leadership, but we have to grow the next generation. So I think you're absolutely right with the question you ask, but it's probably too early for us to tell you the exact answer.
Thank you for that.
Okay. I've got Dr. Mirali would like to speak. Simon would like to come back. Who would like to come first? Dr. Mirali?
Hi there. Thank you very much. No, there was nothing particular I wanted to add other than just reiterate what Genevieve said when Julian asked this question about access to GP appointments. And I just want to comment to say that I think it will all work out for the better. I can tell you that one personal experience, if you like, at our practice, all appointments requested are given either on the same day or the following day. And that is a big sea change from what it used to be. So I think I want to reassure Julian that this e-consult that you're talking about is simply a tool. It does not get rid of any of the previous method of access. So those who are not IT literate or don't have access to smartphones can still ring up GP practices and make the appointment in the traditional manner. I really feel it is all going to work out for the better. And after all, it's a national directive that GP practices nationally had to implement some sort of electronic tool from the 1st of April.
Sorry, can I just ask Julian? Julian, are you happy with this, with the answer? Julian?
Yeah.
Are you
Yes.
there?
I'm not concerned. I think it's a major step forward. In fact, I think it's probably jumped the introduction of e-consulting by 2 or 3 years, because it's become a must to be available. And I think when patients and practices learn the advantages, it will be used more and more. Its ability to direct patients to go to 111, its ability to direct them to go to a nurse, not a GP, all of this within the system is a major step forward, saving GP time and making the whole system more efficient. All I was doing was saying that at the moment, I think, is the interface with patients where they're seeing the change, whether it's caused by COVID or not, which I take Genevieve's point entirely. That's the reason for it. But I think as the practices learn the advantages and the patients learn the advantages, it will become much more the norm, while still there being facilities for people that aren't electronically literate. Thank you.
Thank you. Okay, Simon would like to come in. Rina would like to come in. Can I invite them, please?
So I think my comments were generally covered by others on the workforce. The only thing I would add is that there is a sector workforce group task force being set up. I think it's chaired by Claire Murdoch, who's the chief exec of CNWL, and it's got our directors on it. And there is they are looking at different roles within health service. And clearly there is a big pool of staff that is likely to become available because of the impact of COVID in terms of people looking for different career opportunities going forward. So they're thinking about that in terms of the sort of training and support that they could give to people to bring them into some of those newly designed roles, and in particular apprenticeships. And I think in particular attracting, creating appropriate roles for BME candidates in our boroughs across London.
Thank you. Councillor Veena Mithani,
Thank you, Chair.
you want to
I
come
wanted
back?
to ask Carol about care homes and how many deaths we've had, and have we got enough PPE for care homes, and how are we doing with the healthcare support staff or care workers in care homes?
Okay. No.
Hi.
Hi.
Yeah, I think the care homes have been a really big issue during this pandemic. When we get one case in a care home, it's very rarely just restricted to that one case, and it seems to spread very, very quickly. And so we have had some care homes that have been very badly affected. And one of the things that we've been doing is we have well, I'll start with PPE. We did have a lot of issues at the beginning with access to PPE, and we've been working with the West London Alliance, who have been procuring PPE on behalf of the North West London. That has actually gone so well that the rest of London have actually wanted them to procure PPE on their behalf as well. So our PPE supply has been regular. As Simon said, it's not always been in the quantities that we want, but most of the time we've had stock. The council supply is, of course, an emergency backstop, but it's certainly been needed in our care homes. We recognise that there's some people in care homes who have what are called aerosol generating procedures, and there's people on ventilators, people with tracheostomies, and they finding visors and eye protection was certainly an issue, but we've got that resolved as well, and finding the right sort of masks, because they need the close fitting proper masks rather than just the surgical ones. They need the FP3 masks, FFP3 masks rather, and we've actually arranged testing. We've done, I think, something like 10 days of testing, fit testing for all the staff working in those care homes to ensure that they're protected. I think the other really good thing that's come out of all of this is the way that everybody's been working. So adult social care, public health, GPs, CCG, and of course the community trust have all been meeting on a regular basis. At one point we were meeting every morning at 9 o'clock to review which care homes had any problems, where we were going, who we were going to be testing, how those tests were going to be taken. James's team have been fantastic, and we can give a big shout out to Brian in James's team, who has just been a godsend. And then North West London CCGs as a whole have also set up an infection control team who have been going into care homes to help them both with their infection control procedures and making sure that they're wearing their PPE, but also looking at things like how they cohort patients to make sure that the patients who have got symptoms or have had a positive test are kept separate from the rest of the people in the care home, and that the staff are separated as well. We've passed on the funding that the government has given to the care homes. 75% of that has already been passed on to them, so that's good, and that's helped them be able to pay for any additional staffing or and cover any additional costs that they might have had. And we also have a weekly meeting with all the care home managers, so that they can raise any issues or any problems, and make sure that they're kept up to date. So we cover all the new public health messages and the ever-changing guidelines, which seem to change on an hourly basis at sometimes. But I think that's been I think the response has been fantastic, but it hasn't completely protected us from the number of cases. We've tested every care home for older people and people with dementia. We've now tested, ahead of the NHS England request, we've tested all of the care homes for people with learning disabilities and mental health problems. And we're now looking at people who are living in supported living and those who are domiciliary care patients as well, and making sure that the staff from the organisations that are caring for them are also tested to make sure that we're not harbouring any virus. Also, North West London, I have to say a big thank you to North West London CCGs, who have agreed that we will be testing the care homes once a fortnight, ahead of any announcement from SAGE and NHS England.
Lovely, thank you.
Thank you.
Can I just add on one question?
Yeah, sure.
Can I get Paul in? Paul, you
Yeah,
is
go on.
waiting for
Get
last
Paul in and
20
then I'll,
minutes.
come back again. Yeah.
Okay, let me bring him in. Can I invite Paul Hewitt, please? Hi, Paul. Sorry, I haven't forgotten you.
And so I don't feel forgotten.
Thank you.
I just wanted to take the opportunity. We were talking about the workforce earlier on, and I think it is right and proper that in my role, I do pay tribute to the social care staff as part of the system. I think one of the big pieces of learning for the public during this time of COVID has been the recognition of the skills, commitment and dedication of social care staff, and the need for us to maintain a training regime for them and give them parity of esteem, and that's the term that we use, with nurses and other practitioners within the system. I know from my personal experience that our adult social care staff have been working relentlessly 7 days a week to this very day, and particularly the hospital discharge team, but not just the hospital discharge team, but the support given to the care homes and the care home staff themselves, and the staff who deliver home care and supported living. So I think one of the big pieces of learning from this emergency has been that public recognition, a clap for carers, not just for the NHS staff, but for carers, which emerged later on in the emergency. But I think that's something we should not lose, and hopefully we will not, because that's the whole point of having a health and care system. So I want to give my personal thanks to social care staff within North West London, but in Harrow in particular.
Thank you. Would Simon Brown like to come, or is it Simon Crawford? I'm not sure.
I didn't get that. Could you try again?
Sorry, would Simon Brown like to
yes,
come?
Hello, Chair.
Hi, Simon,
yes.
Would you like to come in?
Yes, thank you. The problem with speaking after Paul Hewitt is that he pinches everything that I was going to say. He was listening to what I said at a previous meeting, and he's nicked all my lines, because what he says is so true, not just for our social care staff, but for professionals across our partners have worked so hard. They have been working 7 days a week, and I guess it's starting to show in some cases. And the other thing he says is that we, going forward, will not and must not forget that the care providers and colleagues who work for care providers, and it's not just the care homes which are mentioned in the forward plan, but also our domiciliary providers and supported accommodation, and those colleagues that work in institutions looking after people with mental health illnesses also need to be supported and not forgotten going forward. I think, I should also welcome Javina and the CCG into the Civic Centre, well, virtually into the Civic Centre, since
Yes.
they've now moved in with us.
Yes.
Well, at least all their chairs have arrived. So when the pandemic is over, there are plenty of places for you to sit now, Javina, but it's all part of this integrated working together. And that's why I think coming out of the pandemic, I'm really very optimistic going forward, because we have seen how well and how quickly we've organised ourselves to work all our partner organisations so closely and so effectively together. So that gives me very great optimism for the future. Obviously, we've got to work through the second wave. We've got to work through any localised areas in the care homes or elsewhere that come up, and I'm sure Carol has got everything in place for that. Communications are going to be very important, and we as a council can help in that, particularly communications into some of our communities that are not always easy to reach and may not really be willing to listen to someone on the phone saying that they've got to self-isolate or give details of who they've had contact with. So we've got a job there, I think, to take on to make sure that that works properly. And then going forward, it's, as the plan says, it's looking at the multiple ways in which health inequalities affect all of our residents here in Harrow, whether they be elderly, geographically based, employment, housing, and indeed very much the BAME community. So that is going to be our focus and my focus going forward, to ensure that we address that, and within the borough plan that's addressed as well as within the plan we're looking at tonight. So I'd like to again add my thanks from the administrations for all the hard work that so many people across Harrow and across North West London have done to help us and help our residents. So thank you, Chair.
Thank you. Can I invite Javina first and then Councillor Natasha Proctor?
Thank you, Chair, and thank you, Councillor Brown. I just wanted to say thank you so much. We're really excited to be finally at the Civic, and we started, and I was there at 7:45 on Monday morning with everything working and the place intact. And so there's no hiding and lots of work to be done. But thank you very much for your warm welcome, and we're, onwards and really building on the work that we've done. So thank you very much.
You're most welcome. Was there anything else, Javina? It's that Simon Crawford wants to come back. Simon?
No, I didn't actually. I did.
Okay, that's fine.
It was obviously the other Simon. I'm going to need to leave the call shortly as well, I'm afraid.
Okay, thank you. Can I invite Natasha?
Hi there. Sorry, lots of what I was going to say has been said there, but yes, I'll just reiterate my thanks to all of the staff that have been working so hard. I know certain residents have been in touch to say that they've been really impressed with how things have been dealt with in this situation. So yeah, same as been said. Thank you.
Okay, thank you. Can I invite Veena again? Veena Mitani? Hello? Is Veena there?
Veena, you're on mute, Veena.
I'm unmuting myself. Probably Paul Hewitt may be able to answer. How has the voluntary organisation partnership has been working? And I must say that voluntary organisations have helped a lot of residents distributing food and collecting pharmacy prescriptions. So I think I'd like to thank the voluntary sector as well. But Paul, have you got anything more to add to say how they have been helping around?
Okay, so we do have Mark Gillam on the call. We also have Alex on the call. So I'll make a couple of comments and then they'll allow them to say something for themselves, really.
Mm-hmm. Okay.
In the way that I was saying about social care staff coming into their own during this COVID pandemic, I think it is equally true of our voluntary and community sector. We've always had a strong voluntary and community sector in Harrow, but I think it really has been the foundation of our response in the community hub and for shielded people. Alex, you're probably better able to comment on the detail, but certainly that's been our experience.
Thank you, Paul. Chair, is it okay if I kick off?
Yes,
and then Mark Gillam can come in as well.
Sure.
So early on in this, before lockdown, we started meeting with the voluntary sector, with the infrastructure organisation and others on a weekly basis. As lockdown came in, we were already starting to focus on what we figured would be the issue around food dependency and hardship. So obviously, as shielding came through, we prioritised the need to get food support out to shielded individuals on a daily basis. So in effect, since probably the first time that we received our lists of shielded individuals, which started at the back end of March, we have been supporting daily food runs through the voluntary sector out to shielded individuals. We've launched a portal called Help Harrow, which was launched in April. That allows people calling into the council staff to fill in details on the Help Harrow portal, which therefore then enables food to be arranged and supported for delivery through one of our food hubs, which are set up around the borough. Just reflecting what Paul said, I think the effort from the Vol sector has been nothing short of amazing. I think that's been partly to do with the fact that, you know, the council and the sector have had a good partnership arrangement for many years now. So we've built upon that, hence the fact that we started meeting early on what we could do together on this. The council very quickly made funding available. So ultimately, we've put in £600,000 to date to support the voluntary sector. And we've worked with the sector on the distribution of that, more so than the council picking who it feels should be getting the money. So we put that into an emergency fund, which has had 200,000, around about 300,000, which has gone into information and advice services, which would include such things as befriending and bereavement support. And then a further 100,000, which is broadly available for those organisations whose business model has been severely impacted by the COVID-19 pandemic. But, you know, there's still a way to go. We're now planning on recovery. We're now planning on the sorts of things that we can do both in the health economy and also more broadly around supporting what's going to be a very long tail from COVID-19. So things around hardship from the economy and job losses and things like that. So from that perspective, I think we've done brilliant to date, but I think we're at one of the first rungs on the board of the game, as it were.
Okay, thank you. Can I invite Mark from Mind in Harrow?
Thank you, Chair. Just also to explain my role, I'm, as well as being Chief Executive of Minds in Harrow, I'm also the Chair of Harrow Community Action, which is a voluntary sector consortium that's been running for about 5 years and represents around 30 voluntary and community sector organisations, delivering services to many vulnerable residents in the health and social care sector. And as Alex has been saying in a very concise and eloquent way, we have been working very closely with the council from the first moment that COVID-19 started to hit the community. And that has, as Alex was saying, that has been because Harrow Community Action and the voluntary sector have developed over many years a positive working relationship with the council, which has come good now. And we were able to shift very quickly working with the council into something that the sector has been offering to some degree, food banks, but into a much wider response very rapidly in a matter of weeks to develop a new food distribution system. We've also, across the sector, been working quietly and without much of maybe the high profile praise that other sectors have had, maybe the NHS and other sectors, but there has been a revolution in the voluntary and community sector to transition to offer services digitally and remotely, which the sector has adapted to admirably, and has supported thousands of people in need in the last 3 or 4 months. Examples are from the Harrow Community Action Services. We run the Care Act Information Advice Service called SWISH, which is a partnership of 5 voluntary sector providers who have supported hundreds and hundreds of people in the past few weeks with all kinds of needs related to food distribution, prescriptions, pickup, emotional well-being, hardship, social isolation. We also are the organisation that leads on the social prescribing service in Harrow, which is a really positive partnership that's established between public health and the council, the voluntary sector with 5 organisations, and GPs and the primary care networks. And the social prescribing link workers have been supporting shielded patients to access a range of different types of support. And also in the background, we have been, as Harrow Community Action, supporting the sector more broadly with their capacity and raising funds. Fundraising has been massively affected by COVID-19 because the sorts of events and activities that people used to do previously in the community now no longer possible. So working with the council, we have been managing the distribution of grants and also applying for funding. So recently we've been awarded a government grant for more food distribution, which is really positive for the borough. And also we are likely to be one of the distributing organisations for a lottery grant fund for small groups in Harrow. So overall, I think that we have worked very well together, and there's a really solid foundation for the voluntary sector and public services to continue to grow and develop and work more closely. I think there's some way to go. I think this is a foundation, and there is some way to go for us to work out in how it applies, not just for COVID-19 and what we've learned from COVID-19 as a partnership, but how this can be rolled out more broadly across the whole sector long term. And we are working with Alex in the council, and sure we'll be working with NHS colleagues on what that looks like.
Okay, thank you, Mark. Can I invite Veena Mitani again?
Thank you, Chair. I just wanted to take on from we heard about the mental health and the financial impact. How is it going to affect all health care sectors, including council, and how are we going to address this long-term impact on finance because of this COVID work, which none of us had expected? So probably Paul and Javina might be able to, and Carol might be able to say, because I'm sure it's impacting on all various sectors and North West London hospitals as well. So whoever wants to come in, please, if you can, just tell us what will be the financial impact and how will it affect Harrow residents.
So thank you, Councillor. I think it's a really, really important and pertinent question. I don't think we have the answer to give you yet, because I think all of the accountants are sitting with their calculators dotting up all of the money that we've spent. So I think we're still in the process of getting the information. No doubt we will have to curve back the spending, and we're already seeing it in some of the discussions that we're having. But I think it's too early for us to be able to give you something very concrete without really having, all of the information sitting behind that. But I can assure you that those conversations are going to be taking place very soon. We're already having to, make decisions in terms of, we set up hot hubs, for example. We have a fantastic service which has been provided, absolutely amazing, at the Alexandra Avenue. And I just want to acknowledge the work of Andy Slater, who is, who has helped enable some of the things that we're doing, particularly, you know, in terms of testing, etc. It's just absolutely been amazing. And what we have been trying to do now is, as the numbers of presentations have been going down, we do need to ask those pertinent questions. Can we afford to keep the, you know, the hot hub open for such long hours? So whilst we don't have the details about the money, but we are beginning to think of all of those things. And that is in every element of the service. And I'm sure that's no different because, you know, we are one North West London system, and we might have different financial envelopes, but we have, you know, we have one whole North West London financial envelope that we are collectively accountable for. So I think it's indeed a really important question, but the answer to which we don't have at this point. So perhaps at the next scrutiny committee, we will come informed to provide you some more detail. But I don't know if other colleagues want to add anything.
Okay, anyone would like to say anything with Javina?
Oh, in terms of the budget, I don't think we're going to expect to be in surplus. So, and there are so many unknowns and imponderables that in putting a figure to it is virtually impossible. So we don't know what government are going to do in terms of other funding pots. We think we'll be okay this year because there is some recognition from government that we need support, but sooner or later the efforts for COVID will have to be paid for. So that's something we look forward to with some trepidation, but I'm sure we will work it out.
Okay. I think on that note, I'm going to
I've
close
got
the
one
meeting.
final question. Can I? It's
Okay,
not a question,
quick one,
actually.
please.
It's just.
I'm going to start charging you now.
Yeah, I think it's my topic to my heart. So I just wanted to say big thank you to all healthcare workers. But I'd like to say that in this healthcare workers, laboratory staff always gets forgotten, especially biomedical scientists and all laboratory staff who are working flat out to deliver the results on time. And now we got this track and trace, so that's going to add burden. So thank you to all staff, including the laboratory colleagues.
Okay, you've taken
done well in
words out of my mouth
supporting
now.
us in this difficult time.
Thank you.
That's all from me. No more questions for tonight.
Good, good. Thank you, everyone. Thank you very much for this virtual meeting. I'm afraid I might have made a couple of mistakes, but I think I've managed quite well. So thank you very much for attending this virtual meeting, and good night.
I must say you did well, Rekha.
Thank you,
yes,
Veena.
definitely. Thank you, Chair. It was really good.
About me
First,
charging her.